10, 9, 8, 7, 6, 5, 4, 3, 2, 1.
The Richmond Health and Care Plan describes our vision, priorities and actions to meet the health and care needs of local people. Our plan has been developed in partnership with residents, voluntary and community groups, health and care partners and health and care providers, all of whom have proactively shared and developed their views through consultation engagement events. Our plan identifies the actions we will take to create a health and care environment, enabling communities and residents to lead healthy lives and be confident in their ability to care for themselves and for others. The actions fall within 3 key areas of start well, live well and age well, with prevention, the need for early intervention and support for carers featuring across all these themes. The 2-year plan focuses on the actions which no single organisation could achieve alone. By working together, health, social care and the voluntary sector can deliver quality health and social care services that support local people.
I am a huge fan of the Daily Mile. It's a fantastic national initiative that aims to get more children out of the classroom and walking, jogging or running for 15 minutes a day. We know that nationally about 1/3 of children are overweight, and that's a local issue for us too. That's why our local health and care plan has a specific priority about reducing childhood obesity.
When I finish the Daily Mile, I feel hot, sweaty, and I think I might feel a bit more focused.
They can do it at their own pace, it's not a race, you can keep times if you want to, some of the children like doing that. But the key thing is that at any point in the day, the teacher will bring the children out into the playground and they'll exercise for 15 minutes. I'm really pleased to hear that all the other primary schools in Richmond are going to be adopting the Daily Mile. It's such an easy thing to take on. There's no extra resources that you need. So actually, all of the children can benefit from a very simple little idea, really.
We are Youth Out Loud! I joined Youth Out Loud because I'm very passionate about changing and possibly learning more about the way the health system works in our local area.
It felt really good that we were given a voice in this project because we feel like young people need to be listened to in all aspects that affect them, especially ones around their health.
Treat Me Well campaign is a national MenCap campaign, and it's about improving healthcare for people with learning disabilities. One of the things we're working on is working with people in health to have more training around learning disabilities, because there's an issue there about people not really having had enough training. Another key thing is accessible information. So one of the key parts of the campaign that we're working on is working with people to improve the accessible information that they send out.
You need to have the reassurance, the time and everything to voice their concerns to the doctor, to put forward what's wrong with them, to tell the doctor how they're feeling and just give them time.
The Live Well theme in the Richmond Health and Care Plan is very much about creating an environment that supports and promotes healthy choices. If we do this really well, we'll be able to see more people having a healthy weight, eating a healthy diet, drinking sensibly, and not smoking. Prevention runs throughout the Richmond Health and Care Plan, and if we do this really well, we'll be able to enable all our residents to live happier, healthier and more fulfilling lives.
It's so important that end-of-life care is a priority in Richmond Health and Care Plan. We at Princess Alice Hospice are committed to nurturing compassionate communities, places where people are ready, willing and able to have difficult conversations and support each other to live and die well. Another key element of what we're doing at Princess Alice Hospice is to encourage people to talk about death and dying. We know how important it is to have these conversations at whatever point in your life. And we're doing this through a range of means, whether it be having a Before I Die I Want To board at a local fete, where we're encouraging families to talk about their bucket list activities, or actually holding death cafes in local communities, getting people to come along and talk about this stuff. And then for people for whom it's more real and more relevant, we encourage them to have advanced care plans. So we encourage them to talk about their future care and what they do and don't want.
I came unwillingly, but it's the best thing I ever did because the people here are marvellous and they just know everything without you telling them. You worry about things and they help with that as well, and they're so really nice and gentle and kind with you. But I'm so glad that I came.
Richmond Carers Centre provides a range of services to support both adult and young carers. We are really pleased that carers of all ages are recognised in Richmond's Health and Care Plan. Recognising and supporting carers can make a real positive impact to their emotional and physical well-being.
My sister and I and a friend have recently set up a support group for parents and carers of children with additional needs, because that can be quite an isolating thing. And you can have good friends, but with the best will in the world, if they have neurotypical children, they seldom really get it. It's, you know, again, it's quite difficult. And this place is just so welcoming and so open to people, and there's so much for them.
The local health and care plan is our shared collective plan across the health and care leaders that focuses on their vision, our vision and our priorities and our actions. Within 2 years, what are we going to deliver to improve health and well-being for our residents, working together collectively to make a difference.
We hope you have enjoyed hearing a little bit about our health and care plan. You can read more about it on our website